Welcome to On Call After Hours. Thank you for sending in your questions. Sorry we couldn't get them at the live show, and we'll dive into these very quickly. From Sioux Falls, the caller doesn't feel they always get the test results from every test. Isn't this part of telling the truth to patients? Mike?
Yeah, I think the caller might be referring to in a timely fashion, or they did some tests. Some doctors say if you don't hear from me, it'll be okay, or they assume that so the patients don't hear. And I was always against that. I think you always tell people, if you don't hear from me, give me a call. You need to hear your results.
Right. Park Valley, Iowa, thoughts about putting a feeding tube into someone with no quality of life? Mike?
Everyone dies, and remember, do no harm is part of what we say yes to, and so this is in that category of do no harm.
How much suffering do you think people who have a feeding tube or are on respirators, laying in bed?
A lot. We have to sedate them and put them on pain meds so they don't feel the pain and the aggravation of all this. It's not a benign procedure. So the answer is, unless there's real clear indications, I think the answer is no, we shouldn't do it.
Millbank or Mobridge. How soon does hospice get involved in care? Mike?
Probably the sooner the better. I think oftentimes we had mentioned during the show that it's, they get consulted at the 1 or 2 day before death, and really we need to get that rolling as soon as we know we're dealing with a terminal illness.
And mostly it's the doctor's fault to not initiate soon enough. I mean, I'll take the blame. I should have thought about doing this. We should do that as a professional.
Or the other thing we worry about is, are they terminal or not, or how long? And I think we need to recognize hospice isn't just for cancer and things like that. It's for terminal illnesses, heart failure and lung disease. And
I also think that, so they turn around. And so you kick them out of hospice.
Right.
You don't have to absolutely, completely, and totally know.
That happens sometimes.
It does.
Happens a lot.
It does. Prescribed statins and had major side effects. Is it ethical to prescribe something that has minimal results and such big side effects?
No. Next.
Good answer. I mean,
I'm not trying to be flippant, but that's pretty easy.
Mm-hmm.
Do no harm.
Right. And there are side effects too. That's a $5.5 billion a year medication. But there are other medications that have side effects. There's dangers there. We've got to be. That's on the doctor too, isn't it?
Absolutely.
Sioux Falls, what about the times when doc doesn't know what's causing the problem? Keep testing? Give up? How often do you not have the answer?
All the time. I mean, that's a fairly common scenario where somebody's sick, they have a respiratory illness, they want to know what bug is making them sick. We don't have the ability to tell them all the time. And so I think the question is oftentimes, how far do you go? How much money do you spend? Do you send them on to a specialist, a referral center, that sort of thing? And it's a gray area. I think you have to take case by case.
Unfortunately, I think we don't do the old, let's see what happens over time enough. Although people are very demanding of, and if you miss a diagnosis of early cancer, quote unquote, mud on our face, or egg on our face, or whatever it may be. But the point is, it's a difficult thing to be a doctor sometimes when you don't know the answer, and we don't know the answer. Brookings, some years ago, I wrote it down, a living will, wished not to be resuscitated. Now, where is it? Where's my file? How do I find it?
Well, that's a common problem, actually. People arrive in the ICU and they don't have their paperwork, or they have paperwork and it was dated, 1972.
Yeah.
And so that's the take home here. If you don't have an up-to-date living will or advance directive, go get one. And then do what a lot of our family members do. I'm sure this is true for you. My mom has an envelope with all of her papers that's taped right by the front door, so anyone who walks into that apartment, big red envelope, it's right there.
Or in the refrigerator. There's some people who keep them in a little container in the fridge.
So it's a good question, and it's a real problem because someone comes to us without an advance directive, and the family is on their way, and I have a patient who's right in front of me. Do I intubate them or not? I don't know the answer.
And they can't tell you.
And they can't tell me, and so the answer is get it updated.
Yeah. Talk to your doctor about this, though, and it really should be updated frequently. I think we need to talk to our family about this issue, not infrequently. what kind of an end of life would I like to have?
And you know what I ask people to do? Get it updated every 2 years.
That's
It
good.
really helps me if the date on it is 2013 and not 1992.
Yeah.
I think the key
yeah.
there is to talk about it as well, so that
Yeah.
when mom or dad is at your door and the kids are coming from out of town, you may talk to them on the phone. They've talked about it enough where they know and they can talk to you. I think that's important.
I really think it isn't as great of a legal document as it is an encouragement to talk to your family. That's the key.
I agree with you about that. And the other part of it is designate someone as power of attorney. So there's a go-to person that you can talk to, that I can talk to,
Right.
that you can talk to.
Right.
Yeah.
This is a caller. They're not happy with this doctor. That he or she screamed at her, didn't explain, threatened with legal action to the family, an unethical person. What can a person do when the doctor is a bad actor?
Unfortunately, I think that does happen, and I think you have to ask for a different team, a different physician, or you have to take it to somebody else, I think.
I think we all need to know to switch doctors if you're not happy, even if it's a subtle thing. Don't
Yeah,
have.
but you know what? That behavior is never okay. It's never should be tolerated or accepted by us as professionals,
Right.
and never by a patient or a family.
Right.
And every clinical practice and every hospital has a conduit for that family to get additional involvement.
I was the chair of the ethics committee for the State Medical Association for 2 years, and some people would call the medical association about it, and it would come up to my responsibility for the years that I was on the committee and then the chair. And the answer is, you can call the State Medical Association if nothing else, if not the hospital locally.
Or the chief nursing officer or the chief medical officer.
But don't let it go.
Don't let it go.
Last
Absolutely.
question. It seems that the doctor won't come and see a terminal patient. They are dumping a lot on the nurses. Are the nurses trained in communicating with families? Shouldn't the doctor have some responsibility to the family?
Of course.
Absolutely.
Absolutely.
Yeah. And nurses are terrific, by the way. I mean, they
Boy.
really are partners, and they're terrific at communicating. But that doesn't let the doc off the hook.
No,
So
absolutely not.
that's absolutely.
I think
not.
physicians sometimes, by nature feel like there's nothing more for me to do, and that's just absolutely wrong. I think they're looking at the wrong thing when that happens.
Right.
And
Yeah, absolutely.
Consoling and supporting the family and the patient,
Absolutely.
spiritually, in
Absolutely.
a spiritual way.
I agree.
Well, we thank you too for a great show and staying over for a few questions to be answered, and wonderful wisdom. Some people with a lot of great experience. Thank you so very much.
But School of Hard Knocks.
Yeah.
For sure. We've made all the mistakes.
Thank you both.
Yeah.
thank you.
And thank you, and stay healthy out there, people.